Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a fungal ear infection, and we call that otomycosis. There are normally two strains of fungal ear infections that can occur within the ear. The first is called Aspergillus niger, and that's normally identifiable by fungal spores. They can either be black or white in colour, and also an appearance of some woolly strands that protrude from the ear canal. And as you can see, this patient has got those landmarks, so they've got Aspergillus niger, and that's the most common form of fungal ear infection within the ear. It counts around 80% of fungal ear infections. And the other common strain of fungal ear infection is Candida, also known as thrush if it's found in the mouth, and that makes up the other 20%. With Candida, you don't normally get any fungal spores or woolly strands. You normally get a more thick, creamy discharge. On occasions, you can get both strains. I've had that before. And fungal infections are more common, I would say, in hotter, warmer, more humid climates. And for that reason, I do see a big uptick in cases after the summer months when people return from their summer holidays. But also during the winter months, so when people are having really hot baths, and for example, the bathroom may not be ventilated very well, so you get humid, steamy conditions. Patients who go to the gym and the sauna, and there's other people there as well. So to prevent fungal infections, you just want to avoid humid, wet, damp conditions, because they provide the perfect breeding ground for fungus to develop. You can see this piece of debris there. It's got fungal spores all attached around it. Fungal infections can also occur secondary to bacterial infection. So if you've had a bacterial ear infection and you've received medication for that, because the bacterial medication can also kill healthy bacteria that live on the surface of the skin. So on the surface of the skin, it's got its own ecosystem. We call it a skin flora. And you have healthy bacteria and also healthy fungi that colonize that, and they protect the ear canal from more harmful bacteria and fungi that can lead to an ear infection. But in the case of antibiotics, these bacteria they don't actually get killed. They're not able to reproduce. So in a way, they stop breeding, which then allows some of the more harmful fungi to colonize that skin. It's got an opportunity there to invade and colonize the skin, because the healthy bacteria is not able to protect it and defend against it. And if you have an outer ear infection like this patient's got, and just say it was a bacterial infection, you prescribed oral antibiotics, you're again more likely to develop a fungal infection secondary to that. So we're just working on the eardrum now. Now the patient has got a few skin blisters here. They can be hard to identify because you don't know if it's discharge or skin blisters. Skin blisters normally occur because you've got secondary to, in this case, an ear infection. So the outer layer of skin almost bubbles up, and it can be filled underneath with fluid, and it's almost as a protective mechanism. It helps to protect the inner layers of the skin whilst the outer layer heals itself. So the patient just found that particular part slightly uncomfortable, so I came away straight away. So we're more or less done. Now it's neon impossible to get every little last fungal spore out from this ear. The patient will need antifungal medication. If they take antibiotics, it's not really going to help. Although some antibiotic ear medication does contain, for example, acetic acid. So acetic acid can help to inhibit fungal growth, but they would need specific antifungal ear solutions and medications, and quite commonly topical is always better because it can directly come in contact with the fungi on the surface and work its magic. The patient has previously attended before a couple of years ago, and that was a chronic fungal infection. Fungal infections can be quite difficult to completely eradicate and eliminate, and quite often the recommended uses of the antifungal drops is for 2 weeks, and you may need to extend it for a further 2 weeks because they have a tendency of being very difficult to treat and being reoccurrent. So the patient a few years ago had to attend on several occasions, and then we finally got on top of it. On this occasion, the patient did admit to getting water in the ear, and it's just this there right here that they're more predisposed to. You can see there's a bit of a blister to the right of the ear canal as well. So a bit of swelling near the eardrum, the ear canal's a bit narrowed there. So there is a bit of debris left there. It can be there all day trying to remove those, and the patient does need medication now. They can hear significantly better, which is great. Their ear pain went, and I've advised them to avoid water. Or should I say avoid water getting into the ear and moist and humid conditions. Take care, guys. Speak soon. Bye.